I want to tell you about a patient of mine. Her name is Barbara. Barbara is 68 years old, and she came to see me about 7 months ago, frustrated, genuinely frustrated, in a way that I recognized immediately because I have seen it many times before in patients just like her. She sat down in my office and she put a small notebook on the table between us, a notebook where she had been recording her blood pressure readings every morning for 6 months. And she looked at me and she said, "Dr. Chen, I am doing everything right. I take my medication every single morning at the same time without fail. I have cut back on salt. I have stopped adding it to my food. I exercise. I have lost 8 pounds. I am doing everything that everyone has told me to do. And my blood pressure is still not where it should be." I looked at her notebook. Her morning readings were consistently between 148 and 162 systolic, despite being on amlodipine and lisinopril, two medications that together should have been bringing her numbers significantly lower than what I was seeing in that notebook. And when I looked at Barbara and listened to her and started asking the specific questions that I have learned to ask over years of seeing patients whose blood pressure medications were not working the way they should, I found something that her previous doctor had never asked about and that Barbara had no idea was relevant. I found 4 specific foods that Barbara was eating regularly that were actively working against her blood pressure medication, undermining it in ways that she could not feel, could not measure, and had never been warned about. Not by her pharmacist, not by the doctor who prescribed the medication, not by anyone. I am Dr. Daniel Chen, and what I found in Barbara's diet is what I want to share with you today. Because Barbara is not unusual. The interaction between food and blood pressure medication is one of the most clinically important and most underexplained topics in the management of hypertension in older adults. And the 4 foods I am going to describe today are foods that millions of seniors are eating regularly while taking blood pressure medication without knowing that those foods are reducing the effectiveness of that medication, or in some cases, creating dangerous interactions that put their health at serious risk. So let me tell you what those 4 foods are and what each one does and why it matters so profoundly. After 65, the first food is grapefruit and grapefruit juice. Now, I want to start with this one because it is the most dramatic, the most well-documented, and the most completely unknown to most patients, despite being one of the most serious food-drug interactions in all of medicine. When Barbara mentioned that she drank a glass of grapefruit juice every morning for the vitamin C, and because she had heard it was good for the heart, I knew immediately that we had found a significant part of her problem. Here's what grapefruit does inside your body. When you take medication, and you need to understand this because it is one of the most remarkable and most important interactions in pharmacology. In your small intestine and in your liver, there is a family of enzymes called CYP3A4 enzymes, cytochrome P4503A4. These enzymes are the body's primary mechanism for metabolizing, breaking down a very large number of medications, including several blood pressure medications, including amlodipine, the medication that Barbara was taking. When you take amlodipine, the CYP3A4 enzymes in your gut wall and liver break it down, reducing the amount that enters your bloodstream. And this metabolic process is actually built into the dose that your doctor prescribed, your doctor calculated, the dose of amlodipine that would produce the blood pressure lowering effect. Knowing that the CYP3A4 enzymes would break down a certain proportion of it before it reached the bloodstream. Now, grapefruit and grapefruit juice contains compounds called furanocoumarins that are potent inhibitors of the CYP3A4 enzymes. When you drink grapefruit juice, the furanocoumarins temporarily block the CYP3A4 enzymes in your gut wall for up to 24 hours. When those enzymes are blocked, the medication that would normally be partially broken down before reaching the bloodstream passes through almost entirely intact in much larger amounts than intended. The effect is dramatic. Drinking a single glass of grapefruit juice while taking amlodipine can increase the blood concentration of the medication by up to 200%, 2 to 3 times the intended amount. Now, you might think more medication in the blood means better blood pressure control, but that is not how this works. At double or triple the intended concentration, amlodipine produces side effects. That at normal concentrations, it does not. Severe dizziness, unstanding, orthostatic hypotension, that can cause falls, excessive ankle swelling, headaches, flushing, and a heart rate that can drop lower than it should. And here is the additional complication that Barbara's case illustrated. Because the drug concentration was unpredictably elevated by the grapefruit juice on the days she drank it, her blood pressure was sometimes inappropriately low on the days she did not drink it. Her blood pressure was inadequately controlled. She was getting inconsistent readings that neither she nor her previous doctor could explain, because nobody had asked about the grapefruit juice. Amlodipine is not the only blood pressure medication that interacts with grapefruit. Felodipine, nifedipine, nisoldipine, and several other calcium channel blockers are all metabolized by the same CYP3A4 pathway and are all significantly affected by grapefruit and grapefruit juice. Some statins, including simvastatin and lovastatin, that are often prescribed alongside blood pressure medication for cardiovascular protection, are also dramatically affected by grapefruit, with blood concentrations increasing to levels that significantly raise the risk of statin muscle toxicity, called rhabdomyolysis. The advice from the FDA and from cardiovascular pharmacologists is clear. If you are taking any calcium channel blocker for blood pressure, grapefruit and grapefruit juice should be avoided entirely. Not reduced, not limited, avoided. Barbara stopped drinking grapefruit juice that week, and within 3 weeks, her morning blood pressure readings were consistently between 128 and 136 systolic, without any change to her medication dose. The juice had been blocking the very mechanism that was supposed to make her medication work consistently. The second food is licorice, real licorice, containing a compound called glycyrrhizin. Now, I want to be clear about which licorice I mean. Most licorice candy sold in the United States is flavored with anise and does not contain real licorice root and does not carry the risk I am about to describe. But genuine licorice, including many European licorice products, some herbal teas, particularly throat and cough teas, some herbal supplements, and traditional licorice root used in natural medicine, contains glycyrrhizin. And glycyrrhizin has a direct and significant effect on blood pressure that directly opposes the action of blood pressure medication. Here is how. Glycyrrhizin is metabolized in the body into a compound called glycyrrhetinic acid, which mimics a hormone called aldosterone in the kidney. Aldosterone is a hormone produced by the adrenal glands. That signals the kidneys to retain sodium and excrete potassium. When glycyrrhetinic acid mimics aldosterone in the kidney, it causes the kidney to retain significantly more sodium than it should. More retained sodium means more fluid in the bloodstream, means higher blood volume, means elevated blood pressure. Research has documented cases of adults developing severe hypertension from regular licorice consumption. Blood pressure elevations of 20 to 30 millimeters of mercury, systolic, from regular licorice intake alone. And in older adults whose kidneys, as I have discussed, are already less efficient at sodium excretion, the sodium retaining effect of glycyrrhizin is amplified, creating a blood pressure elevation that can directly and significantly undermine the effects of medications specifically prescribed to lower that pressure. One of Barbara's other patients, a colleague I discussed the case with, had been struggling with resistant hypertension for months until someone finally asked about the herbal tea she drank every evening for her sore throat. A tea that contained licorice root as its primary ingredient. The lesson is always to check the ingredients of herbal teas and natural supplements. For licorice root or glycyrrhizin, if you are taking blood pressure medication. The third food is high potassium foods eaten in large quantities when taking ACE inhibitors or ARBs. Now, I discussed the issue of dietary potassium and kidney function in my video on fruits after 65. But I want to address it specifically here in the context of blood pressure medication. ACE inhibitors, including lisinopril, ramipril, and enalapril, and ARBs, including losartan, valsartan, and olmesartan, both cause the body to retain potassium. This is a known effect of both medication classes for most patients. This potassium retaining effect is manageable. The kidneys handle the extra potassium without significant problem. But when very high potassium foods are eaten in large quantities alongside these medications, the combination of medication-induced potassium retention and high dietary potassium intake can push blood potassium above the safe range into hyperkalemia. As I described in my kidney video, the specific high potassium foods that are most often involved are not always the ones people expect. Salt substitutes, which are marketed as a heart-healthy, low-sodium alternative to regular salt, and which are sold in most supermarkets, are made from potassium chloride rather than sodium chloride. They replace sodium with potassium, and a single teaspoon of some salt substitutes contains over 600 milligrams of potassium. When someone on lisinopril is using a potassium-based salt substitute liberally in cooking under the impression that they are making a heart-healthy choice, they may be pushing their blood potassium to dangerous levels without knowing it, without feeling it, until the potassium has risen high enough to affect their heart rhythm. Barbara was using a salt substitute on almost everything she cooked because her previous doctor had told her to reduce her sodium intake, and she had found what seemed like the perfect solution, a product that tasted like salt but was sodium-free. Nobody had told her that the potassium in that product, combined with her lisinopril, was creating a potentially dangerous situation for her potassium levels and for her heart rhythm. I ordered a potassium blood test for Barbara. Her potassium was 5.4, above the upper limit of normal, not yet in the dangerous range, but moving in a direction that needed to be addressed. We stopped the salt substitute, and within 4 weeks, her potassium had returned to 4.7, a safe and comfortable level. Other high potassium foods that are relevant in this context. For patients on ACE inhibitors or ARBs with declining kidney function, include the fruits I discussed in my kidney video: bananas, oranges, dried apricots, avocado, and kiwi, as well as certain vegetables, including potatoes with skin, sweet potatoes, spinach, and tomato products, including tomato juice and concentrated tomato paste. The key point is not that these foods are unhealthy. They are not, in the context of normal kidney function and without these medications. They are excellent choices. The key point is that for patients over 65 on ACE inhibitors or ARBs, particularly those with any kidney function decline, dietary potassium needs to be specifically discussed and monitored rather than assumed to be irrelevant. The fourth food is alcohol. And I want to address this one with the care and honesty it deserves. Because the relationship between alcohol and blood pressure medication is not a simple one. And the advice most patients receive is either too permissive or too vague to be genuinely useful. Alcohol has two separate effects on blood pressure that are relevant. When blood pressure medication is being taken, the first effect is that alcohol initially lowers blood pressure in the short term by dilating blood vessels and reducing cardiac output. This is why a glass of wine can make some people feel relaxed, and why blood pressure measured shortly after moderate alcohol consumption may appear lower than usual. But this initial lowering effect is temporary, and it is followed by a rebound several hours later, where blood pressure rises above its pre-alcohol baseline. This rebound typically occurs 3 to 4 hours after drinking. And in someone who drinks in the evening, that rebound often occurs in the early hours of the morning, during sleep, directly in the window when blood pressure should be at its protective nighttime low. Instead, the alcohol-induced rebound pushes it higher, contributing to non-dipping blood pressure patterns that I described in my previous video, with all the cardiovascular consequences that nocturnal hypertension carries. The second effect is the interaction between alcohol and specific blood pressure medications that can cause an excessive drop in blood pressure. When alcohol and blood pressure medication are consumed simultaneously or close together in time, both alcohol and several classes of blood pressure medication, including calcium channel blockers, ACE inhibitors, and alpha blockers, lower blood pressure through vasodilation, relaxing blood vessel walls. When they are taken together, their combined vasodilating effect can drop blood pressure too far, too fast, causing orthostatic hypotension on standing, dizziness, lightheadedness, and in older adults whose baroreflex, as I have discussed, is already less responsive. Falls that may cause serious injury. Now, Barbara was not a heavy drinker, she told me. She had 1 or 2 glasses of wine most evenings at dinner because she had read that moderate wine consumption was associated with cardiovascular benefit, and she enjoyed it. And I understand that. I did not tell Barbara that she could never drink again. What I told her was honest and specific. I told her that after 65, with elevated blood pressure and blood pressure medication, the evidence for cardiovascular benefit from moderate alcohol is significantly weaker than the popular messaging suggests, particularly given the rebound blood pressure effects that occur in the sleeping hours after evening drinking, and the potential for excessive blood pressure lowering when alcohol is combined with her specific medications. I told her if she chose to drink, the safest approach was to limit to 1 glass, to drink it with food rather than on an empty stomach, to drink it earlier in the evening rather than close to bedtime, and to be aware that any dizziness on standing after drinking was a signal that the combination was affecting her blood pressure more than was safe. Barbara made all 4 changes. She stopped the grapefruit juice, she stopped the salt substitute, she switched to a herbal tea without licorice, and she reduced her evening wine to 1 glass earlier in the evening with her meal. 8 weeks later, she came back with her notebook, and the readings were different. 132/81, 128/79, 134/82. Consistent, controlled, within the target range, on exactly the same medication at exactly the same dose as when she had come to me, with readings of 148 to 162. She looked at me and she said, "Why did nobody tell me this?" And I want to say what I said to Barbara in response to that question, because I think it is important. Your pharmacist, your prescribing doctor, they are not withholding this information from you deliberately. But the information about food and drug interactions is vast and detailed, and a standard appointment does not have enough time to go through every dietary factor that might be relevant to every medication that every patient is taking. And so the conversation does not happen unless someone asks the right question, or unless someone, like the doctor in this video, makes it their job to tell you before you need to ask. Let me bring everything together. 4 foods that can work against blood pressure medication after 65. Grapefruit and grapefruit juice, which blocks the enzyme that metabolizes calcium channel blockers, like amlodipine, causing unpredictably elevated drug levels and erratic blood pressure control. Licorice containing glycyrrhizin, which mimics aldosterone, causing sodium and fluid retention that directly raises blood pressure against the medication trying to lower it. High potassium foods, and particularly potassium-based salt substitutes, when taken alongside ACE inhibitors or ARBs, which already cause potassium retention, creating a risk of dangerous hyperkalemia, and alcohol, which initially lowers blood pressure but causes a rebound elevation during sleep, and which can excessively lower blood pressure when combined with vasodilating medications, creating fall risk in older adults with less responsive blood pressure reflexes. Barbara changed 4 things in her diet without changing her medication, without changing her dose and her blood pressure, came into the range that her medication had been trying to achieve for 6 months without success because of what was on her plate. If your blood pressure medication is not working as well as it should, and you have been told your dose needs to go up before anyone has asked you about grapefruit, about licorice, about salt substitutes, about alcohol, I want you to bring this video to your next appointment and have that conversation before the dose goes up. I am Dr. Daniel Chen. If this video helped you understand something that has been silently working against your blood pressure medication, please share it with someone over 65 who is also frustrated that their blood pressure will not come down despite taking their pills every morning without fail. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real information about their own health. And leave me a comment below. Tell me which of these 4 foods you had no idea was relevant to your blood pressure medication. I read every single comment, and I genuinely look forward to hearing from you. Take care of yourself, and take care about what you eat alongside the medications that are trying to take care of you.